Okay, so let us look at some of the types of surgery. So we have different types of surgeries, and among them, we have surgeries according to how they're done and the purpose of that surgery. So types of surgery include one, elective surgery. So with elective surgery, this type of surgery is just well planned for and it's done in advance and it's done in conditions that are non-emergency. So the conditions that are non-life threatening. So it means that this surgery can be booked for a month later or for 2 months later, and it can be done. So the patient can wait, it's not life threatening, and usually it's just done to improve the quality of life. And then for emergency surgery is a type of surgery that is done because of an urgent medical condition, and the condition may be even life-threatening. Examples, you have trauma or appendicitis. So emergency surgery is done in conditions that are very emergent and they are life-threatening. So a patient can die if nothing is done to save their life. So an example is a patient that has been in a road traffic accident. So a patient that has been in a road traffic accident may actually bleed out to death. And because they're bleeding out to death, they can actually die if nothing is done to save their life. So that is going to be considered as an emergency surgery. So another is ruptured spleen. So where the patient has their spleen ruptured may also be regarded as an emergency surgery. The urgent surgery, this one is done within 24 hours, so the patient can wait for up to 24 hours. But if you delay any longer than that, the condition can worsen or the complications may occur. Then for cosmetic surgery, it is done for beautification purposes or alteration to the normal makeup of an individual or a facelift. So that is also considered as plastic surgery. So people that maybe do not like their physical characteristics, they can have them altered. Okay, they can have them altered and they can actually get what they want. So if they don't like their nodes, the nodes can be altered to their liking. Then for ambulatory surgery is a type of surgery that is done in outpatient departments. It can be done in the doctor's office, endoscopy clinics, emergency departments. So a perfect example of an ambulatory surgery I can give is a patient who has undergone male circumcision. So a patient who wants to undergo male circumcision walks into the clinic the very day. They'll do the procedure and the patient then leaves the actual day. So that will be considered as an ambulatory surgery. And then for diagnostic surgery is mostly done for diagnostic purposes. So examples of diagnostic surgery is biopsy and exploratory laparotomy. So I was saying that if somebody has an abdominal mass, intra-abdominal mass, that intra-abdominal mass can be the doctors or the surgeons can get a sample of that intra-abdominal mass by opening up the abdomen. So when they open up the abdomen, it is going to be, that procedure is known as exploratory laparotomy because they're just opening up the abdomen to see exactly what is wrong with the abdomen. So when they collect a tissue sample of that mass, then to take it to the lab for further investigation, then that will be considered as a biopsy. So that procedure is a biopsy. Then for curative surgery can be done for curative purposes. So that means that this is done for treatment purposes. So examples are tumor excision where for example, the intra-abdominal mass is removed So that is known as tumor excision, or removal of an inflamed appendix. So where the appendix is inflamed, that is known as appendicitis. And once the appendix is removed, that is known as appendectomy. And once the appendix is removed, the patient is going to feel better and the symptoms subside. What are some of the terms used in surgery? We've got ectomy, which is removal of an organ or excision. So the stomach is known as the gastrum. So the procedure is gastrectomy, where they're going to remove the stomach. So in a case of the appendix, because we're removing the appendix, it is known as appendectomy. Otomy is cutting into a tissue. It could be a bone. So for example, if they cut through the bone, it is known as osteotomy. It is known as osteotomy. Then another word is orrhaphy. Orrhaphy simply means repairing by suturing. So where maybe somebody had a cut on the skin, then they repair that. That is known as orrhaphy. So an example is where they remove a hernia. So a hernia is simply a weakening when it comes to a vessel, all right? So it is going to weaken, and when it weakens, they can easily remove it and then suture it back. So that is considered as heniorrhaphy. Then ostomy is making an artificial opening between a hollow organ at the surface of the body, between the hollow organ and the surface of the body. So for example, we have a colostomy. So a colostomy is an artificial opening between the colon and the skin. An artificial opening between the colon and the skin. So another example is an ileostomy, where they make an artificial opening between the ileum and the skin. Then desis simply means to secure fixation by operation. So this usually is done on joints. So where maybe one joint moved or dislocated, then they need to fix it back or put it back in its original position. That is going to secure it, but they need to operate this patient before they actually fix the joint back. So that procedure is known as arthrodesis. Then we have pexy. Pexy means fixing an organ. Pexy means fixing an organ. So an example is orchidopexy. So orchidopexy is a procedure that is done to fix the testicles and pulling them back into the scrotum. So sometimes when children are born, especially male children, maybe they'll have one testis that has descended into the scrotum, the other testis will not have descended. So because the testis hasn't descended, it is still stuck in the inguinal region of the abdomen. So they need to pull that testis down into the scrotum, and that procedure is called orchidopexy. Then we also have plasty. So plasty simply means modeling or rearranging an organ. Modeling or rearranging an organ. So a modeling or rearranging of a joint is also known as arthroplasty. And then seal means, or it refers to fluid in a cavity. Okay, it refers to presence of fluid in a cavity. So an example is hydrocele. So hydrocele usually occurs in the testis of males. So when the testis of or the scrotum of a male is filled with a lot of fluid, it is going to be called hydrocele. Then anastomosis. Anastomosis is simply a surgical connection between two structures, usually connected between tubular structures such as blood vessels or loop of intestines. So, for example, if somebody has a blood vessel that is cut and they want to join that blood vessel, that is called anastomosis. Then resection is simply removal of a part of an organ. All right, so let's say somebody has lungs and one lung has a mass, and you want to remove part of the lung. Because they are only removing part of the lung, that is going to be called resection. Then we have ostomy. Ostomy, I think it is a procedure for formation of a permanent or semi-permanent opening called a stoma in the body. All right, so this I think we've already talked about it, which is an artificial opening between the skin and an organ. All right, and then otomy is simply opening into an organ. Then a fistula is an abnormal connection between two organs or cavity and the surface of the body. So an example we have is the rectovaginal fistula. So rectovaginal fistulas are mostly seen in women of childbearing age because as they deliver, the head of the fetus can easily press on the walls of the rectum and vagina, causing damage. So what it will happen is that the fecal content can be coming out through the vagina. So that is what we're referring to as a fistula. So then, who is a surgeon? So a surgeon is a physician who is trained and qualified to perform operations and practice surgery. Somebody who is trained and qualified to perform operations and practice surgery. Then an operation is simply a procedure in which the method of performing anything with instruments on the patient follows a definite routine. So these patients are just not cut with instruments anyhow. They have to follow a routine procedure. So for example, you have a woman who's about to deliver and is about to undergo cesarean section. They're just not going to cut on any area of the abdomen. So they will follow a definite routine when cutting the layers of the abdomen. Okay, so because they are following this definite routine or procedure, that is going to be considered as an operation. All right, so let's look at the management of a patient undergoing surgery. So a patient who is undergoing surgery has to undergo 3 phases. So that is the preoperative phase, the intraoperative phase, and the postoperative phase. So these phases collectively are known as the perioperative phases. So the preoperative phase means the care that you give, or this phase is before surgery. The intraoperative phase is the period where the patient is undergoing surgery. Then the postoperative phase, the period after surgery. So let's look at how to manage this patient before they undergo a surgery or an operation. So let's look at the preoperative care that you're supposed to give a patient who is about to undergo an operation. So for the pre-op period, this is a period from the time the decision is made for surgery till the patient is taken to theater. So this care, hence, is given before surgical operation. So usually in this period, you want to give drugs, you want to care, maybe fix the environment, make it clean. Then you also have to care for the patient's physical and emotional well-being and prepare them adequately for the operation. Then we have in their pre-op care can either be elective or emergency care. So what do we mean? This care can be given in elective situations where you are planned for this surgery, maybe weeks or months ahead, or it can be done in emergency situations where it is vital that this patient goes for this operation. Otherwise, you risk losing their life in emergency situations. So let's begin at looking at the elective pre-op care. So in elective pre-op care, this care is provided to patients that are admitted for a number of days or an outpatient patient. And then it allows for adequate preparation with the following goals. So these are some of the goals of elective pre-op care. That is one, to familiarize the patient with the hospital environment, the culture and norms. So the patient will come 3 days before the surgery so that they get familiar with the environment where they'll be, what some of the rules, where they'll be admitted, some of the equipment they will use after the operation. And then another goal is to carry out investigation and other treatments. such as wound dressing and counseling can be done. All right, so further investigations like maybe cross-match, where you want to see what blood type the patient is, what blood type they can react to. So those investigations can be done. You want to see how much blood they have. So all those investigations can be done during the pre-op care. And if the patient has any wounds, they need to be cleaned and cancelled. Then another goal for elective pre-op care is to improve the patient's nutritional status and general well-being. So that is, you need to weigh the patient, see their weight. Is it too much or do they need it to be improved? So that can be done in the pre-op care. So for the environment, the patient needs to be admitted preferably 48 hours before the actual operating day. And the environment should be clean to prevent infections. It will be well ventilated to allow the environment to be free from infection and dust. Then the environment should also have good lighting. So this good lighting will allow for better observation and reduce fears in the patient. So for psychological care, you need to give care in order to allay anxiety and get rid of the fear that the patient has. And not only are you going to be allaying anxiety in the patient, you also have to allay anxiety in their family members. So if a patient has fear, you'll see that they'll be expressing themselves too much, they'll be talking too much, or they'll be going to the bathroom frequently, they may be withdrawn, they may not be able to sleep, they may even have diarrhea, they may refuse to sign the consent form. So all those are different ways in which people can express fear. So you need to be able to get rid of this fear by explaining what is going to be done, counseling the patient, and also making them feel at ease. So you need to accept the behavior of the patient by showing empathy and by you creating a nurse-patient relationship from the very beginning. So if you create a proper nurse-patient relationship from the very beginning, it becomes very easy for you to talk the patient through the fear, and this will help to allay anxiety. So you have to introduce yourself and other members of the healthcare team. Then other things you need to do under psychological care is you need to ask what the patient already knows about the condition and the operation, and clearly explain in detail the condition of the patient and the nature of the operation. You can even use pictures, videos, audiovisual aids to make them understand exactly what is going to be done on them. Then you explain the procedures, every procedure that you do on the patient, explain it to them, and also the purpose for doing the procedure on them. Then acquaint the patient to the environment that you'll be using, the equipment that you'll be using, and let them practice using some of the items. So for example, if they are going to undergo an abdominal surgery, you can allow them to be blowing up a balloon so that they are able to maintain the intra-abdominal pressure. Then explain also what is expected of them during the post-operative period, and give time to the patient to express his anxieties and also to ask questions and explanations while you listen attentively. So all the explanations and discussions that you have with the patient should be done with you preferably seated. So when you're seated, it will give a feeling to the patient that you are ready to listen to what they have to say and you're not in a hurry. So allay the anxiety also in the relatives and the next of kin by talking to them and explaining the management of the patient after surgery. Then with permission from the patient, explain the nature and the outcome of the operation, involve the relatives also in the caring for the patient, and encourage them to visit the patient. Normally talk to them, provide physical necessities, and provide the emotional needs of the patient. Then introduce the patient to another patient who have undergone a similar or successful operation and provide appropriate diversional therapy. So because the patient is so anxious, you can maybe give them a phone or give them a book or make them watch TV so that they get their mind off the operation that they are about to go. Then all contacts with the patient should be unhurried. So do not be in a hurry in every contact that you make with the patient. Then you can provide spiritual care through prayers and sharing the word of God. Also involve the hospital chaplain. Since the patient may have fear of death or may wish to talk about this with a spiritual supervisor or advisor, you can allow them, their spiritual advisor, to come to the hospital so that they pray together. Okay, so in the cases of deformity, you need to involve the social worker who can offer counseling and social support. So for the anesthetists and physiotherapists, they should also be involved if the procedure is major, as this will help to allay the patient's anxiety. So after the patient has been psychologically prepared, you need to get a consent form and they need to sign the consent form. Because in this psychological care, you've already explained what the condition's about, what are the benefits, what are the risks, and how they can be managed. So after the patient has understood that, they should be able to sign a consent form. So on here, we're going to talk about obtaining consent. How do you obtain consent? So talk to the patient about the condition, the nature of the operation, the outcome, and the patient needs to voluntarily agree. So after they've agreed, the patient needs to confirm by writing his signature or pressing the thumbprint if the patient is illiterate on the consent form. So the consent is going to protect both you, the institution, and the patient against any legal claims of unauthorized surgery. However, there's an age limit and certain conditions when it comes to obtaining consent. So in Zambia, only people above 18 should be able to give consent, and those that are in good mental state. So if the patient is under 18, they can have their consent form signed by a relative or their guardian who is mentally stable. So if the relatives are not available, the head of the hospital should be the one to sign the consent form, depending on the hospital policy. But remember that the consent form is only valid for a period of 2 weeks. So if within 2 weeks the procedure hasn't been done, you need to collect another consent form. So for the observations, you need to immediately start with the observations as the patient walks into the ward or clinic. So you need to look at the gait or how the patient is walking, their posture, to see if there is anything abnormal. So you have to do the vital signs, that is the temperature, the pulse, the respirations, and blood pressure, to detect any abnormalities. So on the skin, you need to observe for rashes, skin integrity, and pressure sores. You need to weigh the patient to note whether they are, to actually note their weight, because as you give the drugs, some drugs may be weight dependent. So check for odd scars, which can be due to previous operations. Observe for the patient's reaction to pending surgery, such as irritability and denial, and also observe for the degree of pain. Then history taking should be done. So for history taking, you need to ask if the patient, if they have any conditions in the family like diabetes, asthma, epilepsy, hypertension, psychiatric conditions. And apart from those, you can also ask for history of smoking and drinking, because they can delay wound healing. And alcohol can also potentiate the action of most anesthetic drugs. So it means that a low dose of anesthetic drug will not be able to work in somebody that abuses alcohol, and certain drugs the patient may be allergic to. So for physical examination, you have to do head to toe examination. So you have to assess the skin, the eyes, the hair, the tongue, and rule out things like pallor, dehydration, malnutrition, and edema. So on the chest, you have to check for lung function, auscultation, and percussion. Then inadequate lung function can possess a risk to complications such as pneumonia or delayed wound healing, and also check for vital signs, especially blood pressure, because it can be indicative of whether the patient is stressed or whether their heart is actually able to tolerate the surgery. Then nutrition. Proper nutrition is important to enable the patient to withstand the stress of surgery. It may promote healing, rest, and exercise. Sorry, it can promote quick recovery. All right. And then when it comes to nutrition, you need to give a high protein diet, carbohydrates, and vitamins, because this will help with tissue repair. It will help with energy and also repair with improve the immunity of the patient. Then for therapeutic nutrition, you need to advise the patient that the meals should be frequent, at least 3 hourly. And then if the patient is obese, advise them to lose weight. And if there's a nutritionist, allow them to plan the meals of their patient. So the patient should also take in plenty of meals and metabolic